Hi, good morning, everyone. How are you? Welcome to the Get to Know SPCA Community Animal Clinic webinar. We are pleased to have Dr. Chow, our local vet, with us today. So without further ado, I will hand over the time to him. If you have any questions on the topic, please post them in the Q&A function instead of the chat. Over to you, Dr. Chow.
Hi, can you hear me? Nobody say anything, but I guess I can.
Can,
You hear
I
me?
can
Right?
hear you.
So good morning, everyone. So thank you for joining us today. It's quite early on public holiday, so appreciate you all for taking the time. So I guess so I adjusted the title a bit. It's called update. So I guess because I think for our volunteers, y'all don't really hear any updates from us, like what's happening, things like that. And then it's like and then sometimes it'd be a lot of questions or curiosity about what's actually happening behind those closed doors. That's why it's peek behind the curtain. So let me just get right to it because I have quite a lot of slides. So basically what this webinar is about, so as you all may know, the clinic upgrade was done in 2018. So right now it's 2021. So it's been 3 years, and then so for us to re-engage our volunteers, and then also to address some common misconceptions about the organization. So I guess truthfully, the public, some of them can misunderstand us. They may never understand, no matter how much I try to convince them. But I feel like for people who help us, like our volunteers like you deserve to know more about what's actually happening. And then also because like actually there's a lot actually happening, but it's hard for us to do updates because unfortunately updating is also a form of work. Like creating content about what we're actually doing. We do try to do it off and on, but sometimes in the heat of the moment when there's a cat that got in a car accident, that come rushing in, the last thing on our mind is taking out our phone to take video and take photos. And then the next point about making you believe in us again is this currently is so some of the things I try, if I got time, I post on my IG, on my Instagram. And then I was talking to someone on my Instagram profile, but someone who had a bad experience with us 10 years ago. And then I guess I'm not sure, let me just make a pointer. 1 second. How do I make a pointer? Can you see my mouse, by the way? Can you maybe type something? Can you see my mouse? Yeah. So I guess the main thing is, of course, 10 years ago I was not involved, but I put arrow is I feel like the main theme is to make people believe in us again. And then another thing is also, I bracket the word proud here is because I do help out with other AWGs quite a bit. For example, SOSD, and I feel like the SOSD core staff and the volunteers have a very good relationship. And then I feel like the SOSD volunteers are really proud to be SOSD volunteers. Then sometimes I look at some of the social media backlash about SPCA on Facebook, on IG. I also feel quite bad and sad for our volunteers because I feel like sometimes we almost make you feel embarrassed to admit that SPCA volunteers, even though you contribute your time, effort, some of them even donate to us. So I feel like it shouldn't be something they are embarrassed about, it should be something you're ashamed of. So it's also, I feel like we need to do our part to make you feel proud to be a SPCA volunteer. So that is why the idea for this webinar came about. Yeah. Then, so a few seconds to pitch my IG there also. So I guess the disclaimer is opinions are solely my own. If you are upset about whatever I said, you can address it directly to me, nothing to do with SPCA or any other affiliated organizations. So I get, if it's good, then yes, share. SPCA, be happy about it. But if it's bad, then you just come and talk to me. We will try to sort it out. Yeah. So the next thing, so a bit about me. So I guess because some of you may be first time meeting me. I graduated 2015. I involved in SPCA since 2017. And then that's when we do our upgrading, getting equipment, the new layout, these things like that. I did a certificate from Ian Dunbar's Dog Training Academy. Ian Dunbar is a first-gen dog trainer and a vet in UK. And then I also the fear-free shelter program graduate, fear-free certified vet professional also. So the fear-free is the idea of learning how to think from the perspective of the animal, trying to reduce stress and reduce fear in them. I also volunteer on the Singapore Vet Association. I was the treasurer, I was the secretary, I was the editor. Then so what does SVA do? We just do industry reviews, talk about guidelines. We try to organize events about continued education so that the vets can stay current with modern advancements in veterinary medicine. So we're quite active. Like last year, COVID, what are the new guidelines for COVID, operating in a COVID world, and then pet vaccination guidelines. AMR is antimicrobial resistance, which is going to be a core focus in the coming years as well, which is basically bacteria being resistant to antibiotics. And then the next one, I guess, is also the main author for the SVA proposal for approach to dog bites. More than 80% I wrote it. I guess I wrote it here also because, truthfully, I think up to this point in my life, that's probably my greatest contribution to Singapore, really, because it's a problem, it's an issue that we need to address. And then next part is the Ministry of National Development. There's a working group talking about guidelines about rehoming and adoption. I'm so proud of it. And then the next slide, this works. No, I have to click. So underline the fear-free shelter program because I think it is a good program for volunteers. So it's free for volunteers. So we'll talk about just now how the fear-free program is about reducing stress and fear and anxiety. For a shelter environment, unfortunately, in the intensive home setting where animals from different areas suddenly not live together in close proximity, unfortunately, for sure, there will be some form of stress. So the shelter program for fear-free is to try to reduce that stress. So if you have the time or if you're interested in this topic, I highly recommend you go to the website and then you just sign up, and then it's free for everyone, really. And then the next slide is actually more. So I guess, so I also mentor for Temasek Poly, some of their veterinary diploma students, and then some of the high risk strays that are very sick, I also bring home to foster. I also work in private practice to maintain relevance and perspective, because sometimes if I do feel over the years, if I'm just stuck at Sungai Tengah, I lose perspective of what's happening outside. So like I do see some of the animals that we bought for adoption as pets outside, and then it helps me make decisions, making me realize what's the other side of the story. Because sometimes we tend to miss out the pet owner's perspective. And then currently pursuing postgraduate qualification in small animal surgery. So we are very lucky that Dr. Patrick Maguire, which is a specialist in small animal surgery, does come to us. So this guy here come to us for surgery, and then I have opportunities to learn from him. And then later I'll talk about other specialists who help us also. So I guess these two slides more of the showcase that actually we are working a lot. We're really doing our best. And you rest assured that we are doing all we can. And so we'll find out more what we actually do in the next slide. Yes. So I guess also I've given a lot of talks over the last few years. One major feedback is I'm not that eloquent as a public speaker. So I mean, it's quite this is quite sad. But anyway, I'm more comfortable writing, to be honest. And then I guess this slide is to let you know, I have a book up for sale at the SPCA merchandise store. It's called the Fulfill Journal. It's about the journey, about finding fulfillment. The main thing is that 100% revenue goes to SPCA. So I think it's like $35, and then all $35 goes to SPCA. So if you ever want to just donate money, right, might as well just donate the money and then take a book. And then, but I think also our stock currently, I'm not 100% sure, I haven't had time to check the store in the meantime. The reason why I mentioned this book is because one of the topics I cover in this book is about personal core values. So about what's important to you in your life. Sometimes it's good to just stop in the middle of the hustle and bustle in the middle of life, just to think about what actually is important to you. So for me, what's important to me is impact. So making a positive difference in the world to help as many animals as possible. Why I mention this, because I'm sure it's the same for you too. That's why you're here in the first place. That's why public holiday, you could be sleeping in, but I actually woke up and joined me on this webinar. So thank you for that. Yeah. So now it's a confession time. Actually, this webinar is actually not for you. It's actually for the animals we see at SPCA. So these are some photos that I just have saved in my phone. And also a point here about easily 1,000 more. Truthfully, it's easily 2,000 more. We do 2,000 rescues a year. And then part of it is we are painfully aware of our own limitations or what we can do by ourselves. And for sure, we can do more with more help. Yeah, so I guess Diana, which is the dog on a wheelchair, is sort of our mascot for a few years. T'Challa passed away a few months ago. Iman is a cat that heart stopped beating for 30 seconds. She was dead for a while, but she came back. And then now still up for adoption. Hopefully she'll get adopted soon. Then Baby Girl is a cat that has very serious fungal infection that was featured on Channel News Asia last year. Till now, still receiving treatment. Yeah, and this is my dog, Mira, also rescued from SPCA. She's sleeping on the table now. Then, so I guess it's talk about a symbiotic relationship that we need each other. I mean, technically, you don't really need us, but I guess if you want to help more animals, then we have a role and a way and an avenue for you to do so. So together we can amplify our collective efforts and then help as many animals as possible. I think that's the ultimate goal here. So the clownfish and the anemone, I really like this concept actually about working together. Yeah, so about helping more animals through collaboration, so that I guess not just the clinic, the organization itself, the SPCA can able to better help animals, and then you to better help animals, and then the animals also receive better care and help from us. So it's a win-win-win situation. So I guess talk about, if you take an objective view about local animal welfare industry, sometimes there's a bit of friction here and there, but truthfully, animal welfare is not competition. There's actually no point in fighting among ourselves. Sometimes it's easy to find fault in others, but I guess talk about this circle here, talk about your proactive focus and a reactive focus, right? A positive energy, enlarge the circle of influence. Like, how do we improve ourselves? How do we become better? And then when you improve yourself, your circle of influence expands also. You're able to do more in this world. So it's important to focus on the big picture. There's no point in fighting. If we help, if we work together, we don't need to be, I mean, sometimes two individuals may not be friends, but you can still work together professionally for the benefit of the big picture, which is the animals here, the community animals. And then the concept, I guess, about core values, about win-win arrangement, about having synergy is covered in this book. It's not really related, but I think like, if we can improve on ourselves, become better human beings, we can have a better impact on this world. So I just highlight this book, The 7 Habits of Highly Effective People, which if you ever got a chance to read, if worth going to Book Depository or Kinokuniya to get a copy, highly recommend. Which are all these topics that I just mentioned, all these concepts are covered in this book. So where are you right now in Singapore? So the status of the local community animal population, right? So cats is like, it's explosion already. It's like falling out for years. To be fair, situations are a lot better compared to the last 5 to 10 years because of the consistent efforts to humanely bring down the population by sterilization. So for dogs, it's roughly 3,000 of them. One second, there's one water bottle. Let me get one. That's a sip of water. If you can still hear me. Yeah, so there are roughly 3,000 community dogs. And then I just point here about challenges of an aging population. So it happens in humans as well. But for street animals, community animals, I do see the challenge where a big group of them now are older. All of them have like old kidney issue, old liver issue, like basically conditions that are not treatable but can only be managed with long-term medication. Then it's challenges. It is a challenge for us because if you are owned pet in the household, you have an owner to feed the medication for you regularly on a consistent basis. But how do we do that for community animals? That's very challenging. So anyway, the numbers, there's a very rough estimate because truthfully, no one have very, very accurate numbers, even the government at this moment in time. But then they are working to update those numbers to have a better idea. So, but the next slide, what have we done so far? So actually, maybe you all already know, which is our statistics actually easily available on the website. So spca.com.org.sg financial reports. You can just see the stats for the last few years, several years. So it's actually very transparent. And then recently, one of our clinic staff was on the phone call for like 30 minutes trying to convince someone to bring the community caregiver feeding a community cat. The community cat is sick. We are convincing her to bring the cat to us because she complained that she doesn't have money to bring the cat to a private vet clinic. But then she refuses to bring the cat to us because of the public common stigma about us putting down cats. So she rather let the cat slowly die outside instead of bringing it to us. And that truthfully, that's what frustrates me. I mean, getting misunderstood is one thing, but then when the welfare of the animal is threatened, then this shit is getting ridiculous, really. Because we're really doing what we can to help. And then when I mentioned about the financial reports, specifically what she said was she asked her friends and then they said the stats are too good to be true, which is, come on, it's BS. We don't, I mean, the part of it is we can do so much to show what we are doing. If people don't trust that, then unfortunately, there's limited things we can do. But objectively, you look at the positive side, the stats over the last few years is improving and it is really quite impressive. And it's really because of the hard work by the entire organization, all the different departments, and also our volunteers and our foster network. Because of that, then that's why we're able to improve year on year. Truthfully, this is only possible with everyone. Yeah. So once again, thank you very much, really. Then, so specific to the clinic, so comparing the stats, so the follow the financial year somehow. I'm not very familiar with the admin stuff. So we calculate over a 12-month period. So the last period of 2019 to 2020, we actually did a lot of surgeries. Just keep churning. Most of it are sterilizations. The part of it is to bring down those population numbers. So I guess the main asterisk there is honestly, the team did very well considering of the circumstances about during circuit breaker and phase 1, we were asked by the government to stop doing sterilization. So we only proceeded only when phase 2 started, and we're still able to do more than the year before. Yeah. And then some very, very recent stats, just April, just last month. So actually this one, I don't think the other departments, we haven't released this out yet. So this is really exclusive for you all for attending to this event. So the last 30 days in April, we saw around 300 new patients, and then 751 treatment procedures, including outpatient, meaning sometimes it's a community caregiver that brings the community cat to us for consult, for treatment, and then the cat doesn't stay with us, the cat does go back on the same day. And then we also did 142 surgeries. So we are making improvements. The clinic stats itself, the main things, I guess, big part of it is actually our manpower size. With this kind of caseload, we have more people. So we're doing it with less people. So it's 50%, around 50% of the manpower of the team size compared to outside for a typical clinic that sees this number of patients. So I guess I want to just highlight here that it's not sustainable because, wait 1 second, because the next slide, or this concept called capacity for care. So capacity for care basically just means meeting the needs of every animal admitted to a shelter. So I guess capacity for care, C4C, is the single most important concept in shelter medicine. And shelter medicine is also a veterinary discipline, just any other discipline like surgery, dermatology, etc. But shelter medicine is specific to looking after shelter animals. And then when we operate beyond our capacity for care, we actually endanger the welfare of our animals. Then the circumstances where the animals will be living will be just similar to simply animal hoarding. Yeah, so that's why we have to be very important about what is our capacity of care, not exceeding it. So I'm saying that the clinic operating and with lesser manpower is not sustainable because we're actually exceeding our capacity for care. So what more about shelter medicine? There's a quote here. Actually, I went to check. Albert Einstein didn't say this, but anyway, it's basically you shouldn't judge a fish about how its ability to climb a tree. So it's about different yardsticks. The reason why I bring up this analogy is because for SPCA, we benchmark ourselves against international shelter standards and try to follow the best practices overseas. But I guess the Singapore general public unfortunately lacks adequate understanding of scientific and animal welfare concepts. And then because of that, they also unknowingly condemn the same standards we follow. I'll explain more later. But basically, there's a mismatch of expectations from the public about what they want us to do and then what we aspire to become. Yeah. So talking about online, talking about condemning us, basically. So the better the experts, I like this a lot. So recognize experts over time. Unfortunately, look at social media now. Look at websites now. Any Tom, Dick, and Harry can build a website. Any Tom, Dick, and Harry can start a YouTube channel and then start like renting. And so talk about social media. So this particular, it's a bit long, but this is a summary. So basically, this happened very, very recently. It's about a viral post talking about a rescue group just saying how bad SPCA is, and they say that we are overwhelmed, not doing enough, not doing properly, etc. They tell people don't send to SPCA. And then interestingly, the same group continues to send stray community cats for us for sterilization. I mean, we do still see the cats because some of them are really sick, unwell. They still do need care. So unfortunately, we do have to be the bigger man or woman here and do see the community animals. But truthfully, we do waste a lot of time and effort trying to debunk the myths about ourselves. To really, our efforts and time better spent trying to actually help the animals who actually need the help rather than keyboarding warriors. So we have a department, the comms department, help us with this, and then their time is better spent doing other stuff also. There are more constructive things they can do. So talking about how some of the experts are formed, there's this phenomenon, this cognitive bias called the Dunning-Kruger effect, where people with limited knowledge in a specific domain overestimate their own knowledge and competency. So actually think about it, it's truthful for a lot of fields, not just shelter medicine. But actually, there is sometimes a lot of people, when they first try to learn about a topic, they reach here and then they stop. So they think they know everything. But actually, the more you know, the more you realize it's a very complicated topic. So it's the same for shelter work, it's the same for shelter medicine. But I guess the danger is when a lot of people, they are here very vocal, really, and then they try to shape policy, they try to shape protocol. It can be detrimental for the shelter, really. But I guess for us, we are quite lucky that we are so used to people bashing online. Sometimes we just do what we know is right. So we just sort of ignore the noise. So I guess another way of explaining it is a lot of times it's just the tip of the iceberg. A lot of times what you know is actually there's a lot more really. It blows your mind. Every day we are learning something new. Every day we are very humble about what we learn. So it's very important to stay humble, and then very important to know that there's always room for improvement. And very important to always endeavor to be better. So talking about the tip of the iceberg, for sure, as I'm doing this webinar, right, I was thinking there's no way I can finish this in 1 hour because there's a lot of concepts, a lot of things I want to explain, a lot of things I want to showcase. So that's why I call it a peek behind the curtain as a subtitle for this webinar. Because if you, the idea is that we're going to cover more topics, do the deep dives, explain the rest of the iceberg per se. It will be an ongoing series of webinars. We'll cover a wide variety of important topics. Shelter medicine specifically, shelter medicine itself is like a university topic in vet school. Animal welfare science, how do we assess animal welfare? How can we improve animal welfare? Pet health husbandry and science, which is like when we are volunteers, when we advise potential adopters about husbandry, how to cut nails, flea and tick prevention, all these things. And then I guess the clinic protocols for medical cases. I guess just top my head, be like when we do FIV, FELV testing, these things like that. And then another thing I didn't put out here is also the behavior aspect as well. The equipment assets that we have, which also is at the end of this webinar. I think like a lot of times a big part of it is trying to see what we have. So I squeeze them all into this webinar. But if you have more questions about specific equipment, we can follow up on in the later session. Case studies, I'll try to sprinkle it here and there. So the primary motivation is the lack of training material in the local context. And then that's why we try to fill in the gap. And the training for this series of webinars can be used to train future volunteers as well, and even staff, actually, when a new colleague join the team. Yeah. So a big part is why, once again, so a lot of our struggles actually, a lot of people don't really understand how we operate. And then also I'm thinking like, okay, actually we cannot blame them if you don't try to educate them. So this is our attempt to educate more and more people about why we do what we do. Because like in the age of internet and social media, fake news and myths are rampant. And the most important thing is that whatever we do need to be grounded in science. We can have a whole webinar talking about what constitutes science and what exactly is science. Because unfortunately, I do meet people that don't fully understand that. But I need a scientific approach for animal health, animal welfare, and animal training. So the importance of science is such that if you look at some of the countries that did not adopt a scientific approach towards the control of COVID-19 in the country, you can tell that actually then they are not doing that well. Science is not something to be ignored. Science is around us and something to be acknowledged. And then if you don't follow the rules of science, highly unlikely you'll get the results you want. So specifically for us, if we ignore the scientific basis around the animal biology, etc., we will actually threaten the animal health and welfare. So it's very important for everything we do to be evidence-based, to be scientific-based. So talk about the science part of it. So what actually are these international standards or guidelines that we follow? So the first one that I bold here is the Bible. So it's the guidelines of standard of care in animal shelter. So it's published by the Association of Shelter Veterinarians. So this is our Bible. And then there are other guidelines. The next one is the International Companion Animal Management Coalition. Yeah, sorry. And then this is just a big group. There's like an umbrella for other groups. So World Animal Protection, SPCA UK, and then Wasava is also part of this group. So shelter medicine, like I said, is a whole discipline. We can, if you're interested, we can just go on and on in another webinar. And I guess the main thing here is shelter medicine concepts can differ from conventional veterinary medicine, which is the concept of looking after an owned pet. So it's not uncommon for us where sometimes a vet private practice saw something that we did. Most commonly, for example, our vaccine protocol, and then they were like, hey, this doesn't look that right. And then they reach out to us, and then we have to clarify that actually what we're doing is for specific to a shelter setting. That's why it's different. And quite commonly, we do have that conversation to explain to private vets why we do the way we do things. So more about shelter medicine. So like because we do see a right number of rescues, 200 a month. So we do a lot of surgery. A big part of it is medicine, how to treat these animals. But there's also other small little subtopics per se. Epidemiology, preventive medicine. Epidemiology is like the spread of the diseases, how to control them, which is very relevant in the COVID world. Preventative medicine is how to protect the population so that they don't fall sick in the first place. Infectious disease control, but when there's an outbreak, unfortunately, that's the parvo, worst nightmare when it comes. Touch wood, if it ever comes to SPCA, for example, and then policy development, faculty, facility design will be like, how can we have physical arrangements to better prevent the health from being affected, like the cages, how we build the cage, how we build the housing, all these things. And then public health will like zoonotic diseases. So touch wood, there are some diseases from animals that can actually spread to humans. How to prevent that from happening. Then animal behavior aspect comes in where sometimes the animals surrender because of behavioral issues, or sometimes the behavioral issues actually happen, unfortunately, when in shelter, because the animal transitioned from the home environment to a shelter setting, and then the behavioral issue started because of a symptom that the animal cannot cope. Veterinary forensics would be like, unfortunately, with cruelty cases, like suspected cruelty cases, how do we assess these cases? Like, is there any animal involvement, or is it just an act of nature? So talking about Wasava, so 2018, that time, there was a physical event, the shelter medicine workshop. So last month in April was the online one. And that's why I think we invited some volunteers managed to participate. So 2018, I just explain error right here. So this is our WISE leader, our director, J. Pao. And then this is me. And then this is Dinesh, shelter manager. So I guess it's part of the endeavor towards trying to be better, trying to be in a better position to help our animals. So learning best practices, these things like that. Yeah. And then we also had the opportunity to host other shelter vets from other countries, because Wasava is an international event. So they all come down to SPCA. The whole event is hosted by us. So it was quite an interesting event. So back to shelter medicine, capacity for care. So we're going to talk more about it. So what happens when capacity for care is exceeded? So talking about a real life human example about COVID, where in Spain, the doctors are forced to choose which patient they have to save because they have limited resources, but then so many patients getting infected with COVID. Yeah. So that's where a case study where your capacity for care is exceeded. So for us, similarly, we only have 2 oxygen cages. So this is a cat, that's an oxygen cage. So that is our capacity for this specific scenario. Then what happens when we have 3 animals, 10 needs oxygen cage, or 4 even? Yeah, so this is a very real problem that we sometimes have to meet. Yeah, so I guess this is like what they face in the human world, we face as well. So talk about this graph about capacity for care. So let me just explain. So this axis here is the number of rescues we see, and this is over time. So this is the graph. So we talk about human world or COVID right now. We have too many patients have COVID, the high number, and then the healthcare system capacity is this line. If you've got too many patients getting sick, right, they got not enough equipment and medicine to treat them. So we talk about vaccination or talk about social distancing is to slow down the number of patients that get infected, so that the number is always within the capacity of the healthcare system to treat them. So we talk about us, so that's the flattening the curve part. But I talk about us, right? We have a limited capacity, limited manpower, limited medication. So any more rescues that comes to SPCA above this, right? The welfare is endangered because unfortunately we may not have enough medication to treat them, or enough manpower to attend to them, really. Then for us, we cannot control number of rescues. If there's three community cats that hit by a car, got into a car accident, they have to come. If they need treatment, they have to come. No choice. I mean, you can't say no. So objectively, the only thing we can do is to grow our capacity, which is growing the care. This is I put a smiley face here. Just making this line higher, so that let's say more rescues come in, it will still be within our capacity, so that we can cope. If you don't understand, or if I just confused you, you can just express yourself in the comments on a chat box. Yeah. So this is a slide from the April shelter medicine workshop. So I get so the introduction of these two characters here. I mean these two characters, speakers. So Dr. Natasha Lee is a Wasava Animal Welfare Committee Chairperson. Dr. Catherine Polak, only shelter medicine specialist in Southeast Asia. We have the privilege of having her as a consultant, to be honest. She was supposed to come to an on-site visit and training over like 4 to 5 days to help us improve our workflow and our operations. Last year, we have everything booked already, then because of COVID, then it postponed. Yeah, so that's really unfortunate. Yeah, so they were giving the talk in April about shelter medicine, and this is one of the slides that I stole from them about factors affecting capacity for care. So number of animals that we have, length of stay for each animal. So as you can imagine, if each animal stay for 1 day or each animal stay for 1 month, there's a very big difference. And then you think about it, let's say each animal stay for 5 days, and then every day you got 5 new animals, and then very fast you power up. Possible outcomes also. So what we can really do with after the animals get better. For example, releasing back to the community, finding adoptions, and then another one is the euthanasia. To be honest, I mean, there's no way, don't need to be around the bush lah. Why do you euthanize and when do you euthanize? I guess right now off the bat I can just say that we euthanize animals in a concept called medical euthanasia. So that is when there's a grave prognosis and then there's nothing else we can do really. And then what we're doing is prolonging suffering. So luckily for us, our capacity for care for now is good enough to only need to perform medical euthanasia. Even so, like there's a cancer, these things like that, most commonly. Besides that, we are always able to find another possible outcome for the animal. Yeah, so let's say the angry animal, temperament not good for rehoming, then we just put the animal back to whichever void that the animal is from, because the animal is happy outside. Yeah. So I guess the size of the facility, how big we have, I mean money, we always need money to do what we want to do. And another part of capacity for care is the staff, the ability of the staff, which is obviously a big part of our capacity. So this webinar is also in line with this part, this staff levels and training. So if the people involved in the shelter can level up, can do more, can do better, that will improve our capacity for care. So that's also why I'm doing this webinar. So after you realize everything's interconnected. Yeah. So talking about the clinic operating with not enough manpower. So it's temporary solution. So it's stretching the team. So currently right now, the team does work very long hours. Then sometimes after we finish already, the animal is still sick. Then we bring the animals home to foster to continue treatment. So it's just for us trying to temporarily increase the curve, temporarily increase the line so that we can accept more rescues, accept more patients. But once again, it's not sustainable because we talk about why this is bad because in the next slide we elaborate more. But obviously, if you look at any work anywhere, if you're overworked for a long, consistent period of time, you will get burnout, you get fatigue. After a while, you leave because you feel like, wow, working so hard. I mean, you need to take a break. This is too much. So I guess then the part of this webinar or part of this series of engagement trying to think about maybe potentially there's ways for us to tap into the volunteer and foster network. Something to brainstorm about. So why this is bad when we stretch a team too much? So when you stretch a team too much, then unfortunately people start falling sick, people take MC, people truthfully, honestly, people leave because they feel like they're overworked. And then when people leave, the capacity for care, instead of going up, will drop. So it will drop down. So it drop in capacity. And then they further endanger small animals. So initially, right, when you're operating at this capacity, these are the animals that are endangered. But suddenly you bring the line down here, more animals are endangered. Suddenly you cannot do, suddenly you can do less. You cannot help that. Yeah, so that's even worse. So really big part is like, I do try to always think about how do I help the team such that we don't chase anyone away, really. Because we unfortunately we do need them. Yeah. So a lot of times the fundamental principle of shelter protocols, right, is to protect the capacity for care. A lot of times why we do what we do is to figure out ways to make sure that we can, if we cannot increase, at least we don't decrease. At least we hold this line here. Yeah. So what happens for us if we exceed capacity for care? So what happens when we have two animals under your care? So two groups are affected for sure. The animals are affected. The humans are also affected. So the humans I mentioned earlier, overwork, they have compassion fatigue, emotional exhaustion, increased use of mistakes. So I think about this guy in the office doing so many things. Unfortunately, even though you don't mean to make mistakes, sometimes you increase the risk of making mistakes, and mistakes unfortunately can happen. And also, big part of it is also unable to give the best effort per animal. Because let's say you only have like 8 hours a day, right, or 9 hours a day, suddenly instead of 10 animals, you look after like 20. So you can only spend less time per animal. So it's a poor job satisfaction. So this 4-letter Chinese character 力不从心. So basically mean that you want to do more, you have the best of intentions, but you cannot do it. So your actions doesn't meet your intentions. So for the animals, right, unable to dedicate resources for diseases that require intensive treatment. So not all diseases are equal. Some diseases are easier to treat than others. So that some diseases will be like you need treatment every 4 hours. You need like very expensive medication. So when you have limited resources, sometimes unfortunately there'll be times where you need medication. You need to I mean, how to put it? For example, we do commonly put feeding tubes. So sometimes there are cats with mouth issue, or commonly cats that fall from height. They have a cleft palate. So basically the roof of their mouth split into half. So we do surgery to fix it. But then because of the injury, right, the cat cannot eat for like 1 to 2 weeks. So we put feeding tube to provide food. So doing feeding tube actually is a very time-consuming thing. So you have to blend the food to liquid consistency, and then you have to sit down there for like half an hour trying to give the liquid diet. And then you need to do it like 3-4 times a day. And then let's say you have like 5 cats that fall from height in hospital, and then you need 5 cats need to do it, and then each time runs half an hour. And then after that, you have other things you need to do. There are other patients. So truthfully, unable to give best effort for animal, this is the part that really really affects us, where we know that this animal deserves more, but because there are other animals who also need our attention, then that is really the struggle that we face. That's why we start bringing patients home to continue tube feeding, start to bring patients home to continue treatment. And that actually is a temporary solution, because I thought this photo here, this is just someone that our clinic is just too tired. Yeah. So talk about, we're all human beings. There's a limit to how much we can bend before we break. So when exceed needs, when it's too many animals, sometimes we cannot even fulfill the basic needs. Not enough food. So lucky for us, our admin department, our director managed to plan in advance. Currently, right now, all of our dry kibble, dry food is sponsored by Hills. Totally free. So very, very thankful. So never run out of food. The thing about it, there are other rescue groups that face the same challenge where they run out of food in COVID. Yeah. And then if you exceed capacity for care, the animals, they will die from normally treatable conditions. So for example, cat flu can become pneumonia, which is like a serious infection that happen in the lungs. So I mentioned this because this is specific to a shelter setting, because look at vet clinics all over the world. Only in a shelter vet clinic where there'll be cases where cats die from cat flu. And then the reason why I can talk about it openly is because this challenge is not specific to us. It also happens in the shelter vet clinics overseas as well. Because in a shelter setting, we increase the risk of flu happening. So cats from different areas need to stay in near proximity to one another. And for cat flu itself, such stress alone is a high risk factor for cat flu. And then what will happen is that one cat A has cat flu, cat A spread to cat B, and then cat A got better, but cat B spread to cat A. So it's like, oh my goodness, the cat is not getting better. All the cats suddenly just spreading back and forth. And then you cannot really move the cats out of that hospital ward, which is where we call the infectious ward, where all the animals with infectious diseases are housed inside. We cannot move them out because we risk bringing the cat flu virus out and spreading to other parts of the shelter. So when I talked to Dr. Catherine Pollack, the shelter medicine specialist, what can we do for cat flu? Because it's a struggle that a lot of shelters face. So she basically said, to treat cat flu, you move the cat out of the shelter environment. Basically, you take the environment, which is a big part of the problem. So you move the cat to fostering. So, and then true enough, which is what we tried really. And true enough, even without medication, once the cat is no longer in a shelter environment, it's in a home environment, it's not housed with like 5, 6, 7, 8 other cats, the immune system is able to combat the cat flu virus and the cat gets better. Because cat flu in itself, there is a viral infection and a secondary bacterial infection. So even if humans talk about flu, right, human doctors seldom give antibiotics for flu because the virus needs to be defeated by the body's own immune system. Same for cats as well. So there's no matter how much antibiotics we pump to the cat, it still cannot fight the cat flu. Then for us, what challenges we face is that unfortunately, cats with cat flu are also the hardest to find foster homes, because a lot of these fosterers understandably also have cats and they're worried about bringing a cat home from us that has cat flu and then bring the cat flu virus into their home. So we totally understand that. So that's why that's also the other issue. So that's the struggle that we have. And then that's why we still have to treat the cat flu within our facility, within the clinic. And then the next part is about lack of husbandry. Basically like cutting nails, shampooing, cleaning the ears. I just look at the time, it's like 10:50, and then we're only halfway done. I have like 60 slides. So anyway, so like husbandry, basically like, let's say we have one individual, one shelter staff looking after 20 animals. This shelter staff is supposed to make sure that their fur are nicely groomed, their skin, they're showered regularly, the ears are clean, properly fed, the nails are not too long, there's no ingrown nails. But let's say this shelter staff suddenly in charge of 50 animals. This shelter staff has no time to be like cleaning the ears, cutting the nails for all 50 animals. So that's when another thing is also you need to spend time with the animal to detect diseases. So when you're checking a cat, checking a dog, then suddenly there's a lump on the other side of the body. But if you have to look after 50 animals, you got no time to check the animal thoroughly, then that increases the risk of us not detecting conditions. So lack of husbandry, let's say the ears are always dirty, also increases the risk of ear infection. So you cannot properly clean the ears, you not enough time, instead of cleaning 100%, suddenly you can only clean in like 50%, that increases risk as well. Yeah, so I leave 2 blanks here because it's to bring the floor to you. So in the chat, right now, if you think about it, what other ways would the animals or the humans be affected if the capacity for care is affected? So you just type in the chat, you just see, you may have to put the 2, you have to change it to, I just realized you can only talk to a panelist. So if you type right, we do see what you type, basically. So think about it now. Let's say we have 2 animals, too many animals for us to care about. How would it affect the animals? You can think about anything, you just type it down, just for you to think about it. Just to give you a moment, so a thinking exercise. If you don't understand my question, you can let me know also. So what other problems would the animals face when you got too many animals that we cannot look after? Let me think about it right now. So I guess behavior issue also a very important one actually, because behavior training takes effort and time. And then also, exactly, thank you, Felix. Felix talked about behavior changes affecting quality of life. Yeah. So let's say there's a dog that is stressed by other dogs. Then if we have space, you try to house the dog further away from the other dogs. But let's say we have too many dogs, then no choice, this dog has to stay near to other dogs. And then this dog constantly stressed. Yeah, so, and then also another thing is like behavior training is when we don't have enough time to do the behavior training, and then the behavior condition actually deteriorates. Another thing is also behavior enrichment. So providing enrichment for shelter animals. So otherwise they're just in a cage 24/7, they are bored out of their minds, and then they're like those exactly the emotional health. I don't want to pronounce the name wrongly. Claribel, yeah, thank Claribel. So about affecting the emotional health of the animal. So like in a cage 24/7, the whole year will be like some human being tied in a psychiatric ward. They're just bouncing off the walls. They're getting crazy. That's where stereotypical problems happen, where they start like chewing on the metal bars, things like that. Yeah, so all these are not great, to be honest. That's why all this we're trying to prevent, because we are here to help them, not make things worse. Yeah. 1 second. So the next slide. Yeah, so talk about compassionate fatigue. So compassionate fatigue is the emotional and physical exhaustion leading to the diminished ability to empathize and feel compassion for others. So another term they use to describe this is the negative cost of caring. So it happens in a human health sector as well. Yeah, so sometimes referred to the secondary traumatic stress. So a big part of it is that a lot of times particular negative stimulus, you can accept it in small doses. But then if the negative stimulus happen too many times, too frequently, then it breaks the human soul. So I guess these 4 animals here, there's something in common. These 4 animals here are no longer alive. There are patients that we've seen recently, and then they passed away. Yeah, so I guess the death of a patient is something that we have to deal with as vets, as veterinary professionals, even nurses, support staff. And then I guess in a private setting, in a private clinic, it happens, but not too often. But again, in a shelter setting where there's so many of them that come forward to ask for treatment, and then so many of them don't make it. So when Then when it happens too many too often, that's when the compassionate fatigue comes in. That's why I do acknowledge that our team do need some time off to find themselves, to take a break, to before they come back to help the other animals. Yeah, so this cat hit by car, multiple. There's a jaw fracture. We try to fix it. The eye popped out. We did surgery on it. Had another injury in the neck. We bandaged it. Also the feeding tube because we expected it not being able to eat after the jaw issue. Passed away 6 days later. These two cats had a blocked bladder. So basically, male cats have this condition where they cannot pee sometimes. This particular cat, we unblocked it. The community caregiver wanted the cat back, so we give back the cat. Got blocked the second time. Unfortunately, the second time the caregiver couldn't find a cat for a prolonged period of time. By the time he could find a cat, the blocked bladder was very severe already. It's been multiple days. So the toxin from the urea built up in the body for a long period of time. So second time it got blocked. By the time it come back, the condition was too dire. So while we're trying to unblock the bladder, it passed away. This cat was blocked the first time when it came to us. We unblocked the bladder already, but because of the initial blocked bladder, had acute kidney injury. So the kidneys were heavily affected. So we started treatment to try to treat that, but the cat still died from the kidney injury. This dog here, if you can see, there's only 3 legs. So the right hand leg had a bone cancer. So we amputated that leg. And then still died 4 or 5 months later from the same bone cancer. So unfortunately, the bone cancer already spread in the bloodstream already. Yeah. So this dog actually is not a community dog. So it's owned by a part of our low-income family, which we try to help as much as we can also. So how do we boost capacity for care? So like I said, the facility is already fixed. We just moved here. No way we can build a second building. Economy, our control, question mark, because we have a very competent fundraising department as well. So that's why during COVID, we were still able to maintain the operations. Yeah, so we're very lucky, really. If we do need this particular medication that's very expensive, the fundraising department do try their best to help. And then we have very generous donations from very generous donors that we are very aware of, that we can only do what we do because of them. And then talk about sterilization. So we cannot really control the number of rescues we have right now because we don't turn them away. But then sterilization is a way that we can reduce the numbers in the future. So right now, we are able to cope, sort of, because the last several years we have been sterilizing animals, preparing for this moment. So I just wanted to highlight that we have 200 rescues a month. That's like 2,400 a year. So excluding those who are lost animals, so we just find them we just reconnect them with the owners. So those actually don't stay with us for long. And then there's the TNRM, which is the Trap, Neuter, Release Management Program. So it'll be like the healthy animals, you sterilize already, they just release back already. So what about those that are sick? So if you have rescued an animal before for yourself, you understand the effort that it takes to rescue an animal, then stand back to health, and then finding them a doctor. Then you multiply it by the number that we have. There's a lot of effort. That's why it's the need to really safeguard and boost the capacity for care. Yeah. Because it's unfortunately really, really taxing and take a lot of resources. So adoptions affect capacity for care. So if I can press back, I'm not sure if I can do this. 1 second. Yes. So lack of stay. So the animals, if the healthy animals don't stay with us for long, so they get adopted fast, right? It's good for us, so we've got more space. So when phase 3 started, I actually created this meme to share among our colleagues. So when phase 3 animals finally get adopted during phase 3, it's like finally it started raining. Because finally animals are getting rehomed. Finally we have more space. Otherwise we are like making makeshift cages. We are like keeping cats in carriers, got not enough cages. So like finally the drought has ended. But unfortunately now at phase 2, so right now the adoption numbers drop again. Then shit, we are back to where we were last year. So then if you have to think about ways like, okay, this animal look like a stray, was from the streets. Unfortunately, doesn't look that pure breed, since the animal has already proved to be able to thrive in a community environment. That we may just need to put the animal back to community environment, because we have to be mindful of the limited number of resources that we have. Yeah. So sterilization wise, it's the only way we can flatten the curve. If we don't want to turn away rescues. It's the main thing. If we want to turn away rescues, which is what some rescues do, AWGs do, then it's okay. We can flatten the curve anytime. But if we want to keep our doors open for animals in need, right, sterilization is the only way for us to flatten the curve. Because truthfully, there's a limit to the number of money and resources we can pump in. How high can you pump this up, really? So to flatten the curve, this smiley face here. So if you flatten the curve, the population is reduced, right? Then we are better able to cope. So then the next thing is also mindful that some of the crowdfunding websites, right, for charities like Giving Asia, which is where we also crowd raise some funds from. I also see human patients that don't have money, they use the platform to raise funds. So then I look at some of these human patients, what the conditions are like really, really terrible, and then they really, really need the money. So I think like, oh, the money that goes to us, as much as possible, I do think that unfortunately these human patients also need it also. So if there are ways that we can make sure that we need less resources so that the human patients can receive more money, I think to receive medical treatment, I think that's also helpful for society. So that's why we need to make sure that we continue sterilizations to reduce the curve, really. So this slide is just talking about how to boost capacity for care, because it takes time to see the impact of sterilizations. So sterilizations we do now, we only see the impact a few years later. So talk about how can we boost capacity for care now. So we'll talk about it in the future. In each segment, each category, there are ways that we can do it, really. Like we said, a lot of the struggles that we face, right, is faced by shelters all over the world. And then there are shelters that are like hundreds of years old. And then they really sort of like figured out how to do it. So there's no need for us to reinvent the wheel. So we'll talk about this in another webinar. So talk about clinic assets. So this is like the clinic showcase. This is not so much medical I guess a lot of people are just curious what the clinic has. So like any organization, our people is our greatest asset, truly. So currently we have 2 full-time vets who are, not me, I'm a locum vet. And then there's 2 full-time nurses, and then 1 admin and 1 manager. Currently we are looking to hire 2 more nurses, at least 1 year commitment. The job description is here. That's part of trying to boost our capacity for care, trying to able to better help the animals that we see. This photo is old, before COVID. Some of them are no longer with us. They went on to find greener patches. Then it comes back to what I said about the push. I mean, when you leave a place, it's the push and pull factor. We cannot control what's the pulling factor, but we control the push factor. So trying to create a conducive environment so that we don't turn them away, don't make them feel like this job sucks, really. Then so there are this part here. When good people leave, the animals lose out. My core belief. So that's why a big part of it try to give the good people reasons to stay. So talk about advanced general anesthesia monitoring equipment. So this lady here is Dr. Kiran Maiden, who is the only vet anesthesia specialist in Singapore. We are very lucky that she very lucky that she resonates with our cause. So she volunteers, she come down to provide training to provide better GA, general anesthesia, because we commonly see surrenders or rescues who are all sickly dogs and cats and sometimes they do need GA for their disease, for their conditions. So how do we provide a high quality GA for them? Because even among pet owners, there's a stigma against general anesthesia about how general anesthesia is dangerous. There's some truth to that statement, but I guess it's like there's so with medical advancements, it's more about the how do we provide better, safer GA. Yeah, also because we do such a high volumes of sterilizations. So think about last year, if we did 1.5K of sterilizations, that's 1.5K of GAs. Yeah, so if you're able to do each GA 1% better, right? Look at the big picture there. The impact of that is tremendous. And the next thing about surgeries. So we do like 3 to 20,000, sorry, 3 to 20 a day. Sorry, slightly getting mentally tired. So average 6 a day. So this thing that shelters do over the world is the high quality, high volume spay and neuter. So it's the HQHV basically for short. It's where we close the clinic. We don't see external patients for that day. And then that day we just focus on sterilizations. And that's how we do 20 a day. So it's like a conveyor belt. So it's like one of our vet technicians commenting like he likes working in McDonald's. So it's just, so this is how we try to do as many sterilizations as possible. So it's following how they do it overseas. They have like specific guidelines for it. And then some days we do standard sterilizations where we do see other patients, etc., etc. And then there's non-routine. So to be honest, it's quite advanced. Quite proud of us being able to do that. So that for the hamster got alarm, they do remove the alarm for the hamster. And then here is perineal urethrotomy. So basically it's a PU surgery. It's basically for basically a sex change surgery for male cats so that they can pee better. So for cats with blocked bladders, on a recurring basis, we can do a surgery so that they no longer, or they have a dramatically lower chance of having blocked bladders. So it's then this one is this is the orthopedic oscillating saw. I want to show this photo because this is actually a donated item, brand new from a private vet clinic. So we're very, very grateful they donated this to us because they are aware of us doing like a wide repertoire of surgeries. So dental. So we have IM3, which is the brand of this dental machine. It's not a very good view. I didn't take a recent photo of it. So a lot of times we see old dogs, old cats, right? A lot of teeth are really rotten, right? So for the last 12 years, never have a dental done before in their life. So we do have to do dental, remove all the rotten teeth for them. And then diagnostics, X-ray, blood machine, and then microscope cytology. So this one is it's a picture a bit too small, but then this cytology is actually mast cell tumor. So basically, we do like we put a needle into the mass, put a needle into the lump, then we stain it, put it in the microscope, then we can find the cancer cells. Actually, diagnostic. Then the blood test machine actually is state of the art. Really, is like the best possible out there. It is. Most of the clinics, private vet clinics, also use the same blood test machine. And then for X-ray, this condition right here is actually pneumothorax. Basically, this cat got hit by a car. Then what happened here is that there's air that leaked into the lungs, so the cat cannot breathe. So what we did, we had to insert a needle and a tubing to suck all the air out, so the cat can breathe again. Yeah, so it's because of a trauma accident. So the recovery wards is the hospital cages. So we split to them in infectious and non-infectious, so that we can prevent the infectious pathogens from spreading. Then often we run out of cages already. Then we have to use makeshift ones, which is not that ideal. But like we said, we try our best to accept every sick animal out there, sick community animal out there. Yeah. And then another asset is also intangible asset is also our relationship with other vets. So like I said, the other vet clinic that donated surgical equipment to us. And then also this guy here, like Dr. Patrick Maguire, surgical specialist, doesn't come and help us. For him to appear at Sonia Tengah, you need to pay him, truthfully. So you need to raise funds. So for him to appear to do surgery easily it be $3,000-4,000, but he does give us discount. I'm not sure if I can disclose it. But then this lady here, Dr. Saskia, which is an internal med specialist. So reason why I put them here is because general anesthesia, surgery, internal medicine, having 3 specialists help us is really the big 3 really. So we are tremendously blessed to have their help. And then talk about vet volunteers, I censor her face for her as per her request. So the dog having surgery is actually Daniel. Yeah, is it Daniel? Yes, Daniel. So Daniel, this surgery was at 3 a.m. Really. Daniel at 2 a.m. the fosterer noticed that the stomach was bloated. So basically what happened, the stomach twisted upon itself and then started to expand. And then the stomach is squeezing the other organs like a very big balloon. So unfortunately, he can die from it. So I found out at around 1 a.m. Then I was like, shit, we need to do surgery. And then it's a high-risk surgery. Survival rate is like 50%. And at that point in time, I call a friend who I know have a very, very high success rate with this particular surgery, which is this lady here. And then she appeared at 1 a.m. Just like that, just because I called her. Really, really blessed that the vet community is very well aware, to be honest, because of my involvement in SVA, etc., Singapore Vet Association. So they're well aware of what we do, and then they do try to help when they can. I guess the next step is really the public to finally realize what we've been trying to do all these years. Yeah. So what we're probably lacking is the ultrasound machine, which is also technically useful for us because we do see a high caseload of trauma cases, hit by car, cats falling from height. So many hit by car, to be honest. Hit by PMD last time also. But also, objectively, when I think about it, even if we get the ultrasound machine now, we don't really have time to fully utilize it. So if like we have more support staff, then there'll be more time for the vets to actually use the ultrasound machine. But hopefully we'll get there, really. So I guess more of like, for sure, the clinic itself has room for improvement. And then orthopedic surgery, so it's like bone or joint surgery, which is actually also not commonly part of average GP vet clinic repertoire. So but at this moment in time, we do hip surgery and amputations. Here, the hip surgery we do is FHO. There's a few types. We can do the specifics next time. So, but then even the FHO, we will do it because we borrow equipment for our private clinic. And then I put explosively here only because actually, if I may say, it's quite a big deal already. So I guess then the equipment is expensive. So I took a photo here of Dr. Patrick specialist equipment. So this one surgery itself, right? There's like one drill, then there's like 3 different boxes of equipment. This drill itself is like 6K. I mean, nuts. Also, the surgery is technically challenging as well. So honestly speaking, even once we get the equipment, there'll be learning curve for us to be able to fully utilize the equipment. So I sneak this photo while he was doing surgery. Then even this headlight, specific for surgery only because of specific like focal intensity and brightness is like $3,000. So just because it's medical for surgery, unfortunately the prices is like whew. So I do use a rock climbing headlamp. Rock climbing headlamp, Lazada is like $12, but then the light is not as bright. But beggars can be choosers. So ending soon already. So at the end of the day, we are Singapore's only community animal clinic. So we're definitely not the best out there, painfully aware of that. But we can only do our best, regardless of public perception, no matter how tired and overwhelmed, because truthfully, frequently overwhelmed. last week alone on Monday, there was like 8 rescues. 4 of it was trauma accident. There was like bleeding. I was going to die. And then one of our colleagues were like tearing already because couldn't cope. So we're frequently overwhelmed. But we still do our best for sure. So we definitely show up for work the next day because we are well aware of our responsibility. And also we are well aware that for some of these animals that we see, we're their only chance. Yeah. So yes, ending. So this is the tip of the iceberg. Very, very long tip, but then there is a lot more. So what's next? So I guess if you've got any feedback, questions, interested topics, you can send to Lawrence. And then we will take off from there, really. I, for sure, as you can see, have a lot to say. So I will try to combine everything together. And then thank you, really, because we're only able to come so far because of the support from everyone. And because of the big population outside, a big community outside, there's still a lot more work left to be done. So let's continue to work together, figure out a way to work better so we can help them more. Because after all, this is for them, really. So the Q&A is just type in the chat box. We'll just collate the questions. We'll answer them later. And then I do have a newsletter about pet health and husbandry that all of y'all will be automatically inside. If you don't want to be part of the email newsletter, you can just say in the chat box now that I will exclude you. Or once you receive the email, you feel like this is like BS, too simple, I already know this, you just scroll to the bottom, you can click unsubscribe also. Yeah. Then as for the photos always have meaning to prompt me to what to say. So this is like just to showcase the sheer number of animals. Yeah. This is 1 litter of kittens. That's why we keep in the same cage. Then this two is Iman. The cat there was there was dead for 30 seconds. After that wasn't breathing, so was on ventilator for like 1-2 hours. Still up for adoption. Yeah. So because of the incident, basically it's like a heart attack for 30 seconds. So because of that, there's like a brain stroke injury in the brain. So for her psychomotor skills not that good. So she walk a bit funnily. When she eats, also a bit funny. So she can be quite messy when she eats. But to be honest, shouldn't be a deal breaker. I think like she's a very, very friendly cat. Very, very good lab cat. So hopefully she finds a home soon. And then this photo here is my 3 little rascals. So my first cat, then Mira, Rocco, then Mira, and Kiro. So these two are from SPCA. So Kiro is a fall from height. Have a cleft palate surgery done, have a feeding tube, had cat flu. So was after the surgery was like dying. So I brought home to do feeding tube, brought home to nurse. And then after I brought home, I put in so much effort already. Then I built a bond with him. So I didn't let him leave. So I just adopted him. Yeah. So if I'm not wrong, this is the last slide. That's all for everybody. Sorry, the never-ending thing. Yes.
Okay, so we have come to the end of the webinar. I hope you have a better understanding of the SPCA's clinic and the concept of capacity for care. Thank you, Dr. Chow, for arranging this webinar despite your busy schedule.
No.
Yeah, if you have any further questions or you have any interesting topics that you would like us to cover, please email them to me. So that's all for today. Take care, stay safe, and we hope to see you soon again.
Thank you.
Thank you.
Thank you. You can reach out to me on IG also. So a lot of times, let's say I have something at work that's angry, I go back and I post. For example, recently there was this viral post about this people on the cat Facebook groups. So there are Facebook groups dedicated to community cats, and they're just saying that we euthanize a cat. So I'm very angry. So I go back and post about this cat still alive. Then it got picked up by Mothership. So yeah, so you can find me on IG also. And then that is about all.
Yeah, so we'll compile the questions. Then once we have the answer, then I will email to all the participants lah.
Yes,
Yeah.
yes. Okay. Then I gonna close the meeting already, everybody. Thank you and stay safe.
Enjoy your holidays. Bye
Goodbye.
at home.